Good evening, I'm Mike Bush.
And I'm Ann Allred. We know the COVID surge is putting a strain on hospitals. Our Pepper Baker is live outside the St. Louis Fire Department headquarters to tell us how first responders are dealing with a huge surge of calls. Pepper.
That's right. It's a busy time of year for the St. Louis City Fire Department. People are, having heating issues because it's so cold outside, which is leading to fires. They're also seeing an increase in 911 related COVID calls, which has more than tripled before Christmas. And then on top of that, their staff is having to quarantine. So the fire chief spoke to us about how this Omicron surge is affecting their resources.
St. Louis Fire-EMS Service is a trauma-based service. It's people are using us as a primary care a lot of times, which I completely understand.
Along with daily fire duties, ever since the recent Omicron case surge, St. Louis City Fire Chief Dennis Jenkerson added COVID response to their list.
Christmas, between New Year's, they spiked way up. We were handling 50 calls per day minimum, sometimes 60 calls a day of COVID.
That's about 6 times the amount of 911 COVID calls they received before Christmas break. In most cases, Jenkerson says the symptoms aren't severe.
As soon as they get a scratchy throat or, they get a stuffed up nose or, they get a slight fever, they want to call us because they can't get into the hospitals. They can't get into the urgent access cares. We're the primary care providers now, so our numbers have gone through the roof.
They can provide medical transport to the hospital for people who are experiencing severe symptoms, but they can't give tests or vaccinations.
Some people had a crazy idea that we were able to provide COVID tests. We can't. So it's a matter of us going there, checking their symptoms, checking their pulse, their blood pressure, their temperature, and trying to provide a little guidance to them as what they should do, how they should take care of these symptoms, and where they should go.
They run 12 ambulances a day on a 24/7 basis. Each medical transport takes about an hour minimum. With the COVID calls, the patient transfer to overwhelmed hospitals and sanitizing the ambulance afterwards causes even more delays.
We're trying to make sure that the system is available for the people who have severe traumas or severe breathing or cardiac type issues. We just don't want to waste our resources, for people who are questioning how sick they are.
The City Fire Department is also experiencing staff issues. Before Christmas, they had about 2 members on their quarantine list. And between Christmas and New Year's, that number jumped up to about 60. And then now Jenkerson says they have about 40 that are still in quarantine. Live in St. Louis, Pepper Baker, 5 on your side.